Hope Cook with DermCast Live here in Washington, D.C. I'm here with Dr. Orit Markowitz. She is an assistant clinical professor at Columbia, right? Did I get that right? And she's the CEO of
OptiSkin.
OptiSkin.
In the city.
But we all know her as the dermoscopy expert and author of best-selling book on dermoscopy. Welcome.
Thank you.
So you just gave a phenomenal lecture on dermoscopy, and I was sitting on the floor along with about 30 other people because we were packed in there. We wanted to hear your talk.
Thank you.
How did you get into dermoscopy? Like, how did it become your thing?
Yeah, that's a very good question. I mean, I don't think you're like born and you're a dermoscopist, right? But my interest in medicine came actually as an undergraduate. I was like a psych major, and I got really passionate about perceptions in psychology, and that's kind of what led me towards a path into medicine. And the visual kind of makes sense that when I ended up exploring dermatology, that I went right into the minutia of like, new non-invasive. And
Yes.
Back then, which was a little bit ago, dermoscopy was just kind of on the rise, along with some other non-invasive tools, like bigger tools than the handheld, but the handheld is always the go-to. And so that sort of just merged for me, like that was my passion. Yeah.
And you even came up with a color wheel technique or approach to using dermoscopy. Can you give us just a brief overview of what that is?
Yes. So a few years ago, I was tasked to write a textbook on dermoscopy. I was lecturing, and I was publishing, and I had to sit down and sort of formulate, well, how do I approach things? And is it the same? Is it different? And for me, I tend to be a lumper, not a splitter. A lot of the existing dermoscopy textbooks at the time were definitely written by phenomenal, very smart splitters. And I am more like, my approach is very practical. Like, do you leave it or do you, take it? As opposed to focusing sometimes on all of the really exciting details, which is also super important, and I enjoy that as well. And I think that's what led me to kind of that particular approach. It was like, it's this color. Is it elevated? Is it flat? And then you look dermoscopically, and what color is it? Is there a bunch of colors? And what are a few just key patterns? And do you leave it behind? Do you take it off? And that's that.
It makes so much sense to my brain and apparently so many other brains, the lumping approach.
Yes.
Yeah, so how do you do it when a patient is in the room? Like, walk me through, how are they on the table, and how do you hold your light? And
that's so important. So I really value my back.
yeah,
It's very important to me.
yeah, because I was picturing you bent over a million times a day.
Exactly. And I am not. So, when you look at people who are doing skin exams and they're standing and the patient is standing, that's a challenge, right? Because if you are, in fact, using the dermatoscope and looking at lesions rapidly and, trying to capture as many lesions, even not clinically interesting, and honestly, the majority are not so clinically interesting. If you're not doing that with the patient's bed high up, and you standing close to them, you are not going to be able to really make it to work the next day if you're over the age of 25.
Yeah, so your beds go up.
My bed goes up. I have my automatic setting. I have a vertigo setting for patients that don't want to lie flat, but everything gets shifted up, and then they turn on their belly. And, you can always flatten the bed. For the vertigo patients, they actually do okay on the belly. They just can't go back. And, the best visual for like the sides, behind the ears, like hairline, which is a big one for malignancy, as well as feet and toes. Like if I want to look in between the toes, that's very hard to have a patient standing and then they're lifting their foot.
Like a horse.
So like when they're on, yeah, exactly. So when they're on their belly, then I can,
Yeah.
you know, really get in there.
Okay, and you mentioned doesn't matter if you say a brand name, but which brand do you prefer for standing up and just
Oh
looking?
yeah. So I don't prefer any brands.
Oh, sorry.
I actually currently I'm using both the Hyna Delta Dermatoscope and the 3-Gen DermLight 3. I like the 3-Gen DermLight 3 because it's very light, and I like that for a lot of the pictures. And I believe anybody doing dermoscopy, if they can take a dermoscopic image, they should.
Yeah.
And they should do that honestly for. I do it for every lesion I biopsy.
Wow, yeah.
Pretty much. No, always. And I like the Delta. It's like very heavy. It's got a nice large field of view. So I often use that in the clinic as I'm looking at, you know, each lesion while the patient's nice and high up for me.
Yeah. Okay. And you pay particular attention, you said, to the hairline.
Right. Because those are areas that people don't get often sunscreen, right? They don't want to make that beautiful head of hair all greasy. And so it's very important that you look, you know, in the hairline, behind the ears, and between toes. You know, those are areas that sometimes can get missed.
And I did feel better when you said, well, patients with, you know, on the face, like if they have rosacea or severe sun damage, it's really hard to differentiate what's there.
It's okay for things to be hard. And if you're not sure, that's okay too. What's not okay is if you think it's easy and you're overlooking things and you're being really fast.
Yeah.
That's not okay, right? Because then you will miss things.
Yeah.
Yeah.
I think one of the highlights of your lecture was just showing us similar pictures of basal cell and sebaceous hyperplasia and lentigo maligna and regular lentigos. And
Yes. Thank you.
yeah, because it really made me think, oh gosh, I don't want to
This
miss
is the
anything.
difference. But when you see things side by side, then you're like, oh yeah, this is different. This is, yeah, okay.
So helpful. Is there anything that you wish we knew about dermoscopy or wish we would do differently as clinicians?
I wish more people would use it,
Yeah.
right? I wish people weren't intimidated by it and thinking that it would hold them up or limit, you know, their workflow or clinic flow, because it doesn't.
Yeah.
I'm a pretty busy, you know, dermatologist. Like, it's not limiting me. And also that they would remember to use a medium. So
use
carry
everything.
around like a little spray bottle or something. I use it. I don't have to, like, if patients are well lubricated, I don't have to like spray everything, but it's good to spray. One, it sterilizes,
Yeah.
right? Alcohol, like, you don't want to be touching your scope on multiple people.
Right.
Right. And two, you're going to get better visuals. So it's good to use it.
Great.
Yeah.
Excellent. Thank you so much for joining us again.
My pleasure. Thanks for having me again.
Hope Cook here in the DermCast studio in Washington, D.C.